everybody, today we will be demonstrating how to perform a Monogen rapid test kit. Before we begin, you must make sure to have the proper PPE donned, which is safety gloves and a leak-proof disposable lab coat. Once you are ready, you will then need to make sure you have the correct test kit and patient specimen, which for this test is going to be serum. It is also important to make note of the lot number and expiration date of your test kit. Now it is time to get your materials out of your test kit and begin the procedure. Firstly, for this test, you need to label which controls or specimen is going into each cell on the test card to keep yourself organized as shown here. Next, you will begin dropping your controls into the cells you have already determined. Starting with the positive control, make sure to gently shake the control and then drop one drop into the first cell while holding the dropper straight down. Next, you will repeat the same action for the negative control, making sure that you gently shake the bottle and then drop one drop into cell 2 in a straight down position. Then, you are going to remove the top from your red top tube using a safety cloth to prevent aerosols. Once it is removed, you will use your pipette to obtain serum from the tube and drop one drop of serum into cell 3 while holding the pipette straight down, just as you did before. Then dispose of the pipette into the sharps container and recap your patient specimen. Now it is time for your reagent. Gently shake the reagent just as you did for the positive and negative control, but this time you are only dropping one drop into each cell. Make sure not to drop the reagent into the same circle as the controls or specimen. Now it is time for you to begin mixing your reagent with your controls or specimen. Make sure to fill the cell with your controls or specimen and reagent mixture. Make sure you dispose of your stirring utensil into the sharp container as well. It is also a good time to make sure you have your timer set. For this test kit, you will set your timer to 3 minutes, which is how long you will rotate your test card to see if a reaction will occur. Now that 3 minutes has passed, it is time to check the results. Our positive control is positive, our negative control is negative, and our patient is also negative. Finally, it is time to change into some clean gloves and finish our report form in our clean area. The first thing we do is fill out our report time with the date, military time, and the text initials. And then we will move on to filling out what we have seen on this test. So as we saw, our patient is negative, which means there is no agglutination seen. Our positive control is positive, which means that there was agglutination seen. That also means that our positive control worked correctly. And also our negative control is negative, which means that there is no agglutination seen and our control did work correctly. Another thing is our normal reference range. Our normal reference range for infectious mononucleosis is negative, meaning there is no agglutination seen. This is just a close-up picture for you to see how we filled out our sheet. Now it is time to begin putting away our material, putting our controls and reagent back in our box along with our procedure test kit. Also putting our timer away. And now, you will begin bleaching your card. Bleach your card with the 1:10 ratio of bleach to water, and then rinse your card off. Make sure when you're drying your card to dab it dry. We do not want to put a dirty or wet card back into our test kit. Now bring your card back over to your workstation and put it away into the test kit. Now you need to check the temperature status for your test kit, which is located on the box, to know how we need to store our test kit. As we can see, our test kit needs to be refrigerated, so now we will bring it and our specimen over to the refrigerator to properly store it. Now we begin bleaching down our station, which is a part of our final process of the test kit, which is our clean up. Make sure you dispose of the gloves that you wore and the paper towel into the biohazard trash can. And to finish up our test kit, we will wash our hands thoroughly. And once you have finished washing your hands and following all the other steps of this video, you are officially finished with your test kit. Thank you so much for watching.